Hello again, how are you? So I changed the topic title a little bit. I'm going to explain the challenges on how to set up a Theranostics Center from the physician perspective. So in the next 10 minutes, I want to highlight the main challenges that we have. The first is absence of qualified team. The second, of course, the regulatory system. And the third, I want to stress on the value of education and awareness. So let's start by the first part, absence of qualified team. Why is there absence of qualified team? The answer is because Theranostics is a relatively new field. It was not included in our training programs. So my program did not include nutrition, did not include PSMA, did not include going deep dive in prostate cancer or neuroendocrine cancer. What did we have to do? It was all based on personal efforts. We had to attend courses, we had to attend conferences, we had to travel abroad to see other places where they are working. So we had to do it on our own. And the main issue with Theranostics is that it requires different skill set from the nuclear medicine perspective. Usually, our daily job is sitting behind the screen, reporting gamma cameras or reporting PET CTs. Now we need new things. We need new skills, like knowing how to deal face-to-face with the patients, doing more patient counseling. We need to understand different therapies for cancer types and how to sequence them. We need to learn how to use it, radioligand therapies, and when, and how to manage the patient, which is extremely important, and how to follow them up, and how to manage any toxicity if it happens. So long story short, it's too much to learn. It's extra effort. We had to go all through it to learn all of that. And this is why you will find some nuclear medicine physicians that are hesitant to go through this path. I have known some senior nuclear medicine physicians, the head of departments, and they were blocking the service on purpose because they told us it's extra effort we do not want to do, especially that there is no compensation, there is no reward. So why go through all this hassle for nothing? So I have some recommendations, especially for the business side people and from the industry. First, search for the active teams and invest in them. Invest in the personnel. Sometimes I hear that you are investing a lot in the machines, investing a lot in the infrastructure, but I do not hear a lot about investing in active teams. If you find active team, active physicians, train them, help them develop, try to look whatever they need to become better, sorry for that, and to become strong. If you have an active team, they will open all doors for you. If you have a lazy team, you're not going anywhere. Even if you have the best machines in the world, you're not going anywhere. Secondly, the business model, definitely like any business, it should compensate extra effort, like any normal business side. Extra effort, extra risk means extra rewards. So that should be put into consideration. And of course, for the future generations, we need to incorporate Theranostics in the nuclear medicine programs, like Dr. Akram is doing. We need to download the basic information about Theranostics in the newer generation, so we don't go through this hassle for all of them. Now the second part, I will just go quickly through the regulations, because it will never be solved, I think. And the main problem with the regulations is that every region or every country has different regulations. So each one of us is fighting on their own. Each one of us has their own fight, which is a big problem. My recommendations for that, of course, try to involve the regulatory systems in your work. Try to be friends with them. If they hate you, you will have a tough life, so try to be friends with them. And last week, I was talking with a friend, and he said in Brazil, in one of their projects, they wrote their own regulations. So they wrote their own regulations and give that to the regulatory system. So why not all of us collaborate and write like a regulatory system for all of us, because we know that in the next 5 or 10 years, we'll have numerous isotopes, numerous radiopharmaceuticals. The problem is that the regulatory system do not know how to act. They really don't know. They are facing every day new challenges, new isotopes, new materials. They don't know what to do. This is a real problem for them. So why not we do their job or help them or guide them, do a single report, basic guidelines that can be guide them and help all of us. So basically, let's all fight the same fight. The final part, education and awareness. It's extremely important to know that in the theranostics field, we have two customers, the referring physician and the patients. We should be aware of that. For the referring physician, the big problem is how to convince them to refer patients. And that was by far my hardest part in starting Theranostics. A big issue, very big problem is how to convince oncologists to refer patients to you. And for many reasons, some oncologists just didn't have enough data. They said that maybe lutetium will harm my patients. And this is our problem, that we did not communicate the value and the side effects of our treatment. So it's our job to spread the knowledge about our treatment. Some of them were afraid or telling me that lutetium PSMA will only go to the bones, not for the lymph nodes. So this is miscommunication and came from us. So we need to clear this information more. Some of the oncologists just didn't like nuclear medicine physicians treating patients. They said, we are the oncologists, we should be treating the patients. And again, in the private sector, like I work, there can be conflict of interest because the patient goes to the nuclear medicine department, so the payment goes to the nuclear medicine department, not to the oncology. So these are one of the problems that we faced when dealing with the oncologist. And some of the recommendations for the nuclear medicine physicians, please be present in the MDT meetings. It's our job to know or to be up to date. It's our job to know what's happening. It's our job to be ambassadors to our field. So please show to others how nuclear medicine can help their patients and add value. Secondly, it's very important to be present in the other specialty meetings. Not just talk with nuclear medicine physicians or colleagues. You have to go to the urology conferences, you have to go to the oncology conferences, and you have to present scientific, evidence-based data. It's very important. And lastly, please involve them in the therapeutic plan. It will never work without them being involved. They have to be part of the team, and I think this is the best for the patients. They have more knowledge in patient management, so they must be part of the team. So one of the things that we've done, like we made a roadmap. You can do whatever roadmap that you want, name it follow-up, name it consultation, but however, the patient should know that he will be managed by the oncology and the nuclear medicine. So what we do, for example, we tell the patient that the dose is the nuclear medicine, then you do oncology follow-up, then you take the second dose with us, and then you go back to the oncology for follow-up. Anyway, do whatever plan that you want, but please let them be involved and let the patient knows that he's being followed up by the nuclear medicine and by the oncology. Now moving to the last part, for the patients. What do the patients need? They need easily accessed information online. They don't understand our fancy scientific part. They need very simple wordings. It will be much better in simplified mother tongue language, explaining the benefits and side effects, again, very easy and very clearly. And it's important to know that if you win patients, patients can convince their oncologists. So if the patient can see clear information, they will go to the oncologists and tell them, I found this online and it looks promising. Can I take it or not? So use this as a weapon for us. So to summarize, like any business model in the world, we need a good product. And I think we are very lucky that we have good products. We have in the radioligand treatments products that are effective, with low side effects. So this part, we are lucky to have it. Second, we need good service. We need a qualified team to handle the injection and to handle the process. And then after having both of them, communicate that well with the referring physician, with the patients, with everybody around the world. And after that, please take feedback. We always do mistakes. There is always room for improvement. So get the feedback. I'm not sure what's that. Get the feedback from the referring physicians, from the patients, from whoever. Improve the process. Try to make it better. If you're persistent, if you keep improving the cycle, eventually you will have a successful Theranostics site. So thank you very much for your attention.